Here is a 3-minute overview of Medicare. When it's time to start Medicare, you are going to sign up with the Social Security Administration. You're going to do it either online, you're going to do it on the phone, or in person. And when you sign up, what you do is you sign up for Parts A and B. Part A is your hospital insurance, and Part B is your medical/doctor coverage. Once you've signed up for Parts A and Part B, you're then going to get a Medicare number. But that is just the beginning of this process in figuring out your path for Medicare. I mentioned you do your Part A and B sign up with the Social Security Administration. Sometimes that confuses people because, wait, aren't you getting Medicare? And yes, you are. But think of the Social Security Administration as the gatekeeper or as Medicare's secretary, because you got to go through them to get to Medicare. Now, once you have done that, and by the way, if you're already taking your Social Security at least 6 months before your 65th birth month, you don't have to do that step. You're going to receive that card in the mail. But for everybody else, you're going to wait, you're going to receive that card. It's going to give you a Medicare number. Now, once you've done that, you're not done. You now have to figure out, are you going to go original Medicare or Medicare Advantage? So this is when you start to figure out which is the path for you. You can go original Medicare. That's where the Centers for Medicare and Medicaid Services handle your care. It's fee for service. They pay the doctors. We know there's gaps in Medicare. Not every dollar is covered, which is why you get a Medicare supplement policy and a Medicare Part D plan to cover your prescriptions. The reason you want that Medicare supplement policy is that with original Medicare, there's 20% gap in your Part B coverage. So a doctor bill is covered at 80% by Medicare, and that 20% that's not covered is uncapped. So the supplement helps cover those gaps. You also then would get a Part B plan where you'd have a premium and copays for your medication. Now, in the alternative, in the late 1990s, Medicare Advantage Part C was created. And basically what Part C is it combines Part A, B, and typically D into one plan. And instead of the Centers for Medicare and Medicaid Services handling your care, you're going to have a private insurance company and you're going to have managed care. It's typically an HMO or a PPO, and you have doctor networks. And then there's a lot of perks that come with it. And instead of paying a monthly premium like you would for a Medicare supplement, you're typically going to have a low or no monthly premium, but you're going to cost share as you go and have a max out of pocket that you can spend.